My name is Mirosław Czuczwar. I'm the head of the Department of Anesthesiology and Intensive Care in Lublin Medical University in Poland. So I come from Eastern Europe. We are living in a world of change and a world that needs innovation, especially in a very technical specialties like critical care. We have seen a lot of improvement, a lot of new technologies were introduced, and we still feel that we might have lost the guidance in this very technical world, and we need to come back to our roots. So what critical care is actually about caring, and then we need to learn how to implement all these new technologies into our daily practice without losing the background. Well, I think it's the broad implementation of many technologies which extend life of the patient, but sometimes they do not help to cure the patient. So this is one thing. So we know how to keep the patient alive for a longer time, but we still don't know how to cure many diseases, and then there are lots of bioethical considerations which make our everyday work much tougher than it used to be. So this is one thing. Then we have a lot of new problems, everyday problems, such as increased antimicrobial resistance. We have new diseases emerging. We have problems associated with huge migrations around the world, and new diseases, some diseases are already cured and we don't care for them, so we have new ones emerging. So there is a constant need for improvement of our daily practice, and this is what to me personally seems like the greatest challenge. Well, just like every ICU physician, I'm surrounded with machines. All my patients are, so we usually work with, of course, advanced monitors, vital signs monitors, ventilators, beds, CRT machines, ECMOs, ultrasound machines. So we have this technical approach we were talking about previously. Now, the major advances in critical care would be impossible without a wide and broad implementation of these machines. So we have to be skilled in performing many invasive procedures, and all of these technical advances help us with delivering better care and in a safer way. Well, this is an easy one because reliability, credibility, and of course safety. So we need to know that most of these machines, this equipment, is used in an acute setting in critical patients, where we can't allow for any problems, potential problems, or potential for misuse. So these they have to be robust. They have to be easy to operate. They have to be ergonomical, so every one of my assistants should be able to use them at a critical setting without any problems. So these are the values which I treasure the most in my department. Creating a safe and efficient critical care environment requires a very strong support from the industry. And by delivering high-quality equipment which is capable of creating such community, such environment, you have done a very good job, but then again, this is just the beginning of the way. So now I think that it would be nice to see some new approaches, implementing some new solutions to help us with acquiring and processing all this data, which could turn into better outcomes. So let's talk about a critical care environment in 2050, let's say. So I think that we will move into a strictly protocolized intensive care like we see in oncology or cardiology. So we will have algorithm guidelines watching our every step, and we will have an opportunity to use AI-driven clinical aid systems. And this is what I think this is the right direction to move, because the whole world is moving into this direction. So we will have big data systems. We'll have lots of clinical aids aiding our decision, and this is I'm not even sure that we have to wait till 2050. This is right by our doorstep. This change in the clinical care setting. So we should anticipate that this change is going to happen much faster than we thought. So we are gathering lots of data, and it seems that the human mind is not going to be capable of processing all this data. And this is where the AI-driven systems come into play. So I personally think that in the future, the clinician is going to have lots of aids helping us to deliver the right treatment in the right time, especially with this all new technology emerging. And but this is coming up really fast. And we should not miss the opportunity to shape the future, and we should implement all these technologies very fast, because otherwise we might get lost in this world.